Hello, everyone. We are so excited to welcome you back to the GRNEN webinar series. New for 2026 is our AI and virtual nursing webinars, of which today is our very first one. So thank you for taking the time out of your afternoon or evening, depending on where you're located, probably morning for some people as well. We're excited to present this series with you. Today, I am honored to welcome Sandra Schindler. She's going to be our presenter for the AI RX, How Artificial Intelligence is Rewriting Healthcare. Sandra is a family nurse practitioner at Sanford Health, specializing in telehealth, preventative care, and risk adjustment. Her nursing career spans over 19 years, with many years in emergency nursing, quality, and education. Her professional passion centers on rural health and improving access to care using innovation as a catalyst for meaningful change. She lives on a ranch in central South Dakota with her husband and 2 toddlers. So we are going to be holding our questions until the end, unless if there is an emergency. Always feel free to reach out to the chat. And with that, I will turn it over to your presenter. You are on mute.
How about now? We're good? All right. So welcome to everyone here. My name is Sandra Schindler, nurse practitioner at Sanford Virtual Care. I've been in this role about 4 years now, and I exclusively see patients via telehealth. And background expertise in clinical documentation improvement, risk adjustment, and background certifications in emergency nursing and pediatric emergency nursing. And just to give you a little heads up about Sanford Health, we are trying to be a global premier leader for rural health. As you can see, we're mostly in the South Dakota and North Dakota region, with also hubs in Minnesota and expanding into Wisconsin more recently, and also expanding into Wyoming and Western South Dakota. We also have international and world clinics with locations in Costa Rica and Ghana and New Zealand. So we're quite a large organization and growing. So we have most of our population, our footprint. Sanford Health covers 99% of our rural footprint in our area, compared to a US population lives in about 18% of rural areas. And we also have divisions for long-term care and health plans and things like that, covering for our patients. What comes with being in rural care, as many of you know, can be issues for access, quality, and sustainability. And so knowing those things, we lean heavily into innovation and leaning on technology. And so hence why we've really embraced our telehealth care and AI tools to leverage care for better outcomes. We had a generous gift by a benefactor, Denny Sanford, and he wanted to see us grow in the telehealth area. So we do have a physical building. It's near Sioux Falls, South Dakota. It's a house for our innovation hub. We use our Artisite care signal programs, some of virtual nursing there, as well as education, innovation hubs, even a maker space with 3D printing and innovation happening there. So we are growing and have a physical presence. This is information about our virtual care initiative. And for example, we've done over 1 million visits, a lot of e-visits, video visits, secure messaging, a lot of specialties. We have kind of the hub and spoke model. So we have providers that are specialists, maybe living in the more populated areas, that are able to consult in our more rural areas. For example, I live 2 hours from our main medical center, close to a critical access site. And so my child, if they have asthma, for example, and we are just doing a routine follow-up with the pulmonologist, rather than having to take a whole day off work to drive and maybe even spend a night in a hotel the night before to be there for an appointment, and then maybe it's only a 15-minute check-in, we're able to leverage tools to stay in place and save miles and compliance with getting to connected to that expert care. So to speak specifically about AI, and as this is kicking off our AI conversation, there are its own language. There are now even degrees specific to healthcare AI and certifications coming for AI. It's here and it's like, get on the bus or you're going to get left behind, I feel like. And embracing it has, it's disruptive innovation. It changes how we do things, but once you kind of get it under your belt, you're like, wow, where has this been my whole life? This has been so helpful. So terms to know would be machine learning. That would be like computers thinking like humans, from vast critical thinking and problem solving, mimicking human behavior and decision making. Deep learning is use of neural networks, like think of the neurons in the brain, going a little bit deeper, and that is without explicit programming, calling on lots of data points and coming up with answers for people. LMM, the language processing, large language models. That's again taking massive amounts of text data that can generate human quality text. Generative AI is creating new content. So think of that. I don't know if you've seen people who maybe type into an AI of like, okay, create a picture. Here's a picture of me, but put me on a beach and put an umbrella and in sandals, and then it can come up with its own new picture. So that's like a generative AI. An autonomous AI is more like doing it on its own. There's other terms in here like tokenization, entity recognition, part of speech tagging. It gets in the weeds pretty quickly there, but let's just kind of start. If you know these types of terms that are on this slide, that's kind of a good jump start into knowing about AI and how AI works. So how about healthcare applications? If you've been in healthcare for a while, if you're like me, I've been in healthcare now for 26 years, started on paper charts, and then I moved to like the DOS system that had just the green lights and like the black background, and you just use the function keys. And it's slowly been progressing, and it really has taken off since establishing with electronic medical record, where there is vast amounts of data being collected. Do you remember the days of when floppy disks were actually floppy, or when x-rays were actually a printout that you had to use in the light box? So those, we didn't have as much data as we do now using electronic medical records. One of my favorite things about AI is ambient listening devices, and I've been a clinician using this now for a few months, and it's a game changer, really. So how it works is it's embedded into electronic medical record. Best practice is to ask permission from your patient to let you know that you would like to use it. So my scripting generally goes like this. I have a new tool to use. It's embedded into our electronic medical record, so it has health privacy protections through those means. Acts as a medical scribe to capture our conversation today, and it helps with me creating a thorough note and helps expedite the process of creating my note. Do I have your permission to utilize that technology today? And out of many, many patients I've used this on, I've only had one that said, I'd rather not. So then I just use my note just like I normally would have in the past. Typically, it's generating parts of the clinical note. Like I use it a lot for the HPI part of my note, the history of present illness. You can use it for the physical exam portion, but you have to be narrating what you're doing in order for the AI to kind of catch and put that in note form. So that can feel a little clunky if you're not used to that. And then talking about the assessment and plan, it's just really neat how it can fragment and chunk like, okay, we were talking about asthma and now we're talking about hypertension. And it can just, and then maybe we talked about the weather or basketball game and it leaves that all outside of the chart. So it knows how to kind of cut through where things go and what doesn't apply. But yeah, there's about 4 or 5 big players in this space. We currently use DAX Copilot, which is a Microsoft product. But I do hear we use Epic as our electronic medical record, and I do hear that they might be coming with their own solution. So that might be another option. Overall, our internal data says this saves about 7 minutes per encounter of charting time, which means that could equate to seeing like 2 more patients in a day, or clinicians getting out 30 minutes early, or clinicians not having to use their personal time at night to catch up on charts. So it's been a great tool to use to help with burnout and provider and patient satisfactions. I even had a patient today comment today, yeah, I've used that before, and it's kind of impressive to see that it captured our conversation so thoroughly, and it actually made me feel like I was heard. So I thought that was very neat to hear. We see AI in medical coding, and as my background as a certified risk adjustment coder, in coding, people think in the coding world, is AI going to take my job? There is some fear of that. And for anything AI, I would say the overall takeaway is that it's to be used in conjunction and can help take away some of the administrative and redundant types of work so that humans can concentrate on some of those more difficult things. So ICD-10, like here's and I know that's international coding, so I know that the United States isn't the only place that they use this, but my book here is thick. Look at how thick this thing is. And so using this to look up codes, it's been really nice to have AI to use. There's a few on the slide, the different type of vendors where they do computer assisted coding, where they're able to look at the record and then it throws the codes like, we suggest that this, and this. And then you have to have coders or clinicians to, yes, I agree with that. Yes, I agree with that, and edit. And I should go back just with the DAX Copilot with the ambient listening device. I still read through everything that it said to make sure that the AI didn't hallucinate or capture things wrong. I see sometimes it really messes up on specific names of, not on medications, it does a good job of that, but if I'm referring to cardiologist XYZ person, it doesn't do a great job at like surnames, things like that. So it's always best to, you're still responsible for that chart. So I still read through all of it before I approve it into the medical record. Similarly with medical coding, it can help train your coders to be things that they might not capture often on the first time around, or reduces human error, catching codes that may not be appropriate, and helps with efficiency and productivity. Giving real-time feedback helps new coders get better, and provides targeted training. And it's very accurate coding for patient care, billing, and collecting health statistics. And that coding book seems to update every 6 months to a year. So it has the latest and greatest coming from its Rolodex. It's very adaptable, and it changes with the new codes and conventions, as well as learning new procedures. AI has been super helpful in patient access realm. We use Jane, she'll be on the next slide, but we use an AI chatbot, or actually she does some automated calls, and it helps to reach out to members to get them scheduled for annual wellness visits or health assessments. that is the AI helps with texting and emails for appointment reminders. It's been Crimson AI has been a helpful tool for OR suite scheduling and performance. 60% of surgeries were started later than scheduled. And then with implementing this type of AI, they saw that they were scheduling surgery 7 days faster and a 7% improvement on the number of the cases that their OR can support. This even trickles down through supply chain. So think about the OR and getting that all set up and all the supplies that circulating nurses tend to pull. And so if you're more efficient on your scheduling and less cancellations or having to move things around, that even saves on your supply chain data. So they were saying it reduces waste by 16%. It identifies block times, providers that seem or procedures that seem tend to run longer, and it suggests how to redesign OR time. Virginia Tech did an ED throughput AI tool. They called it XG Boost. And they predicted times for overcrowding, and their prediction window was within like 2 hours. And so they used that for like the patient satisfaction side of things, where people could kind of speculate like what are some for those not level ESI level 1 and 2 emergencies, the highest emergencies of emergencies, if you're it's something that maybe can wait or consider urgent care, they were using that throughput tool to help judge that. We use AI for addressing language barriers. There's things like AI Translate or Microsoft Translating, Apple iTranslate, Pocket Talk W, Acrisyn synchronous telepsychiatry app. And I just learned that Jane, she's our AI chatbot, she is bilingual. So she can see as she's reaching out to patients their primary language. I know for sure she speaks Spanish. I'm not sure the number of languages that she speaks, but she is proficient in motivational interviewing. I've heard some of her conversations in training with members, and she does a great job of motivational interviewing and using empathy and asking clarifying questions. She's also the type that would know if a member would say, yeah, I'm at a baseball game right now. Call me back next week. And then when she'd call you back next week, she'd say, how was the baseball game? So she even has some memory to help with scheduling. So that her customer service satisfaction rating is an 8.5 out of 10. So people they've told me, yeah, we had the call from the chat box, but it was it was kind of amazing that she's a chat box. It seemed like she was just talking to another human. So helps with scheduling for sure. AI and radiology. Oh, let's see here. Very helpful in reading technology. For example, if you're a mid-level provider working in ER in a critical access hospital, and it goes into the queue for radiology to read, and it's going to be a little bit, the AI in radiology having kind of that quick preliminary report or feedback is so helpful in the confidence of that provider, and maybe might even save time. Also, they're using it, for example, like you see an adrenal adenoma or a renal cyst or pancreatic cyst that was noted on a radiology report, and maybe there hasn't been followed up in an X amount of time. Like you can set it for 2 years, and that might trigger to revisit those patients that had those types of cysts that may need repeat imaging. So it's helpful in following up on patients like that. So you can cue the AI to look for the word nodule to help with follow-up or closing the loop. Predictive, okay. AI in clinical care, one thing that's been cool in the literature, IDX-DR, which is your diabetic retinopathy exams right there in primary care offices. So patients getting them into the eye doctor may be tricky, or access to care things. And if we can do diabetic retinopathy exams right there, like that with the AI, that can be great to have those rapid results, typically within minutes, and shown to have high accuracy. There's been some predictive modeling uses for the types of conditions listed above. ADHD and autism, the testing there typically takes like 15 minutes with about 70% accuracy. They put on the sensors on these gloves and ask them to touch a target like 100 times in 15 minutes, and can help diagnose some of those conditions. 2023 CMS survey found that 28% of US autism centers had a diagnostic wait time of over 7 months. So this tool could capture some objective data rather than strictly qualitative behavioral observations. But this is still quite preliminary yet, but it shows some great promise in this field. The digital twin is interesting, and how that works is there's Twin Health is a type that does this, and basically creating that same metabolism profile. You take pictures of, it's for diabetes management, and you could take a picture of your food and it would tell you what your blood sugars might do in the next few hours. And so it works kind of along health coaching. They're also seeing digital twins being used in the space of redesign and flow and throughput. And I think we're going to be seeing more of this digital twin technology. We're using it in the world of genomics, assisting in personalized medicine. AI is helping to highlight links for clinicians. For example, the blood testing, the CYP2C19, if you're a poor metabolizer or an intermediate metabolizer, that helps us to know that maybe a different antiplatelet therapy, for example, Plavix might not be the best, but using something like Brilinta or Effient may help with the thrombotic risk. So that's a cool area there. Tailored treatment plans for genetic predispositions, past treatment responses, behavioral patterns, and real-time data. This is an article in an open peer-reviewed journal asking, is Dr. Google or Dr. AI better than my typical clinician? And there was just a minor, in this study, it showed that the chatbot did slightly better than the clinician. In other studies in 2025, there was like 83 studies kind of looking at this same thing of, is AI smarter than the clinician, or vice versa, or together? And most of the studies said that the clinicians, the specialist clinicians were like 1% better, or vice versa. But overall, it's apparent that working together has been very helpful in saving time and using best practices. One tool that I absolutely love and use in my clinical practice, I used to use UpToDate quite a bit to cue what are best practices in certain areas of medicine versus looking in a book. But I've gone away to more using a site called Open Evidence. And you have to have an NPI number or a clinician number to join this website specifically. But it's an AI that basically does a deep dive of literature. And not only do they do that, they specifically outline, where did I get this information from? So if you want to check on their references or deep dive into specific articles on that, you can. So for example, I typed in, are vibration plates helpful for osteoporosis? And came up in minutes, seconds of yes, that they can be statistically significant. And here's why, and here's a study, and here's an article that says why. So I've been really liking that tool. We use a tool called the Care device. And so this is something that like I have in my home because I have toddlers, and we only have ER and we don't have uh, urgent care anywhere near us. And our clinic hours are, fairly more limited than in some urban areas. So what this allows us to do is connect via telehealth to clinicians that would typically are urgent care trained. And then we have a device here that we can listen to the lung sounds. It has an otoscope looking in ears. It has a tongue blade where you can look at the mouth. And Care has been FDA approved in their AI for identifying wheezes, crackles, and now rhonchi. So easy to hear things. The Care has a database of 1.8 million recorded lung sounds. And so it signals real time and intelligently flags potential abnormalities through these reviews. The AI, let's see, the algorithm is very effective. It says that the device itself recognizes things at 95.85% significance versus general practitioners are typically in the 79.4%. So it can exceed the performance of even experts, according to the literature there. And 89% of America is considered rural and medically underserved. We use these on some of our telehealth visits, and it helps to decrease weather-related cancellations, addresses access to care, quality, staffing. One thing to be aware of in the telehealth space is a webside manner, which is different than like bedside manner. I find personally myself that I have to practice the pause a little bit more. For example, if I'm intently listening, am I listening or am I frozen? So you have to be expressive in your facial features. And it's easy to kind of talk over each other, if you're not used to the cadence of visits like that. And being aware for the speaking and respondents while balancing the body language that you're listening and hearing them. And also as a preceptor, as someone who works fully remote, that's interesting on how to navigate that full immersive experience of like, here's our video and here's what the charting looks like, and then those check-ins, and having that team camaraderie through virtual means. So it's its own unique little niche of healthcare, I would say. AI and mental health is showing great promise. We all know that this is a huge need, underserved area, source of expense, not enough clinicians, access to care so many miles away. So our current system has such a demand. We're falling short for accessibility and affordability. So how can AI help support that? One would be earlier detection of mental health disorders, reducing the stigma of mental health, less intimidating to access to care. For example, people using chatbots almost as like therapists. But you get down this slippery slope of, AI not acknowledging that they're not licensed in this, and the handoff to care. So mental health is about 16% global burden disease. It's the leading cause of disability, with depression and anxiety alone costing the global economy $1 trillion annually in lost productivity. Earliest AI application in psychiatry was in the 1970s. They had a chatbot called Eliza. AI would analyze speech, text, facial expressions, alterations in speech patterns, pitch, tone, and rhythm. Contigo voice analysis AI software, Activa emotional AI and facial recognition tools, Ginger is predictive analytics to identify individuals at risk for developing mental health conditions. I think they use environmental factors, history of traumatic events, social isolation. I think they pull also on social determinants of health and lifestyle choices as some of their how they come upon the risk factor. They monitor increased stress levels, disruptive sleep patterns, and risk for social withdrawal. There's tailored interventions in AI like lifestyle changes, offering recommendations for psychotherapy and medication use. Um, when, for example, when users search for depression related terms in a search engine such as Google, it prompts like a PHQ-9, which is a validated depression assessment. And that can also trigger them to seek care or even recognize hotlines that may help with connection to mental care, health care. IBM Watson Drug Discovery has a lot of genetic and chemical data sets to identify drug candidates for schizophrenia and bipolar disease. Chatbots seem to be a scalable option for the demand, around the clock and timely use. Crisis hotlines seem to be using more AI chatbots like a crisis text line, and those are liked by people because they can be very discreet and stigma free. Addiction, it's been helpful in addiction, identifying triggers, stressors, substance abuse, and allowing for timely intervention. There are a lot of other, here, this is from the previous slide, that article, but look at all the type of tools, and I'm sure there's even been more coming since then. BetterHelp used to align AI to help find the right counselor. So often do I hear from patients is, I did try counseling, but that didn't seem like for me. My provider didn't seem like they got me. And for a lot of people, it's daunting to share a lot of that vulnerable information just to be like, we didn't click. So I think that's fantastic that they're kind of doing a match of patient needs to clinician experience and style of care. Aura Ring is a good thing for mental health, helps with sleep patterns, or even, our wearable devices. Helps with activity levels, heart rate variability, stress and things like that. Um, Mind Strong Health is an interesting one, and that is more in the employee wellness space because it kind of tracks how smart keyboards and typing and speed errors, so maybe distractibility. Um, and Chat GPT, there's a mental health counselor part of that, distills some therapy techniques, generates some coping strategies, and enhances resilience skills. So I asked my Chat GPT, how do I get better sleep? And one thing about me in preventative medicine, I am very passionate about sleep behavioral medicine and the newest science in that, using CBTI, cognitive behavioral therapy, for insomnia strategies to help quiet the mind and get better sleep, not necessarily always pushing medication per se. And so this is just even a screenshot of what I asked ChatGPT to, how do I get better sleep? And these are all techniques that are common in CBTI training. So I think it did a great job in something a little more benign like that, giving some advice. I have to laugh at my little Bitmoji there. She's a little tired. AI companions are interesting. You think of elderly folks. I always ask a lot of the people that I talk to about risk for isolation, especially in our cold. I'm in the Midwest, so it gets cold and windy and dark here in winter months, so the risk of isolation. So there's AI companions now, and kind of like the newest, latest, and greatest of imaginary friends. And they can feel quite real. There is some very good pros here and some slippery slopes here too. So they can be used for practicing crucial conversations, like, okay, I gotta share this, that's hard, so let's practice it back and forth with an AI companion before I do it in real life. Um, can feel like you're seen and understood. Like I shared that a little bit different, but said, oh, I read my chart and it really captured our conversation and I felt heard. Yay. That sense of connection, the decreased loneliness. There was an article a little while back of people taking it too far, though, where somebody, ethical concern. Is it considered cheating if you have this emotional connection with an AI chatbot outside of your human relationship? There was it was an AI chatbot called Casper and a gal named Wicca, and they got engaged after 5 months of having this relationship. The AI chatbot and the human person even picked out rings. So, I mean, it's getting in the weeds here with some case scenarios, but I do think it has its time and place. It's also super helpful, AI companions, like an AI assistant for daily planning and reminders. Kind of reminds me of my Apple CarPlay, and I'll be driving along, and instead of looking on my phone like I shouldn't be doing for distractive driving, I would say, hey Siri, what time does the movie theater close tonight in X town? And then it'll say, according to the website, it closes at XYZ. And I'm like, wow, that was really helpful. um, or I'll say, hey Siri, how do I get to XYZ place? And then it'll pull up Google Maps. And would you like me to navigate there? Yes, please. So I didn't have to like try to type that in my phone while I'm driving 80 miles an hour down our interstate, which is quite fast. And there might be some little critters popping out at you and things like that. So virtual assistants, managing emails, managing calendars, things like that. There's some apps there that are some examples for AI companions. But again, privacy, security, emotional independence, bias, could the AI hallucinate and give some inappropriate responses, and then blurred reality lines. Health, AI and healthcare quality. It helps with predictive analytics for like denials, carrier insurance trends. It might, again, back to the coding, may flag ambiguous codes. It's being used inpatient to configure 30-day risk for readmissions, important for like our value-based care strategies or fee-for-service organization like that we do here in the United States. It's easier to track flow through utilizing certain clinical guidelines, sepsis, for example, making sure that they're getting enough hydration and blood pressure support and things like that. Or like my brain, what's the door to EKG times? It can really help with those KPIs, key performance indicators. We've also used some homegrown AI to help with kidney disease and flagging in our charts, like, hey, this person has a glomerular filtration rate of 54. Has anyone, and I don't see that chronic kidney disease is listed on their chart. Well, maybe now's the time to start having a conversation about what does good kidney health look like. Oh, you're really using a lot of ibuprofen. Let's try to cut back on that. Oh, your water intake is only about 3 cups a day or 24 ounces a day. Let's try to get that up to 64 ounces, 72 ounces, those types of things. We also have a tool for colonoscopy or colon cancer risk. So I just had this conversation earlier today, and somebody was not all that sold on doing preventative care, whether that's like their colonoscopy. And we discussed they were average risk, and so per our old guidelines, so offering Cologuard stool testing, but colonoscopy being the gold standard, they didn't really want to go through that. So I was able to use an AI tool that we've built specifically on our data population that says, according here to here, based on age and medication factors and smoking history and things like and weight, it says here that you're three times three times more likely than the average risk population, which was to develop colon cancer. And maybe it's a talking point just to tip them into considering colon cancer screening. Of course, I always say, your body, your choice. These are our recommendations, but ultimately, we're just here to walk alongside you. This can be very helpful for PI projects and things, and it just helps with quick data collection, developing pivot tables or great visuals, helps with operational efficiency, staff satisfaction, and collecting of financial data, like we were talking about the supply chain stuff. Back to the business office, AI can help us with billing automation, helping reduce human effort, decreases human error, flags discrepancy, it learns over time, accuracy and speed, addresses issues before they go to claim submission, reducing denials, doing it right the first time, eliminating that rework, detects coding errors, real-time feedback, you flags like unusual code combinations, issues, specific things with specific insurers, learns from past denials. Populates forms for patient information. So, for example, an MRI form. Back in moons ago, when you had to be a patient to fill out that MRI checklist, you had to put your name and your birthday and some of those things, where now with AI it can populate most of that and just allow the human to double check the accuracy of it. It can identify unpaid claims, send out reminder letters to patients, helps with cash flow and resource management. And we talked about the supply chain stuff. AI in healthcare education, this is pretty exciting. We use virtual reality, and I have like just a little two-minute clip here on that. Simulate, so we're doing simulation not on real patients, so it allows you to make a mistake and not have such disastrous consequences. Adaptive learning, I'll give the example maybe with my ACLS and my recent hybrid experience with that. So this is maybe my 10th time renewing it, but it was able to ask me questions, and if I was excelling at those questions, it was like, okay, you've mastered that content, on to the next, versus me sitting through a class for the same amount of time as somebody who's maybe taking it for the first time, or maybe there's just a certain concept within that class that I wasn't really getting, so it was asking questions in a little bit different format, really deep diving and spending time in that area. So that's my example of an adaptive learning tool. Automated assessments and feedback, as a former nurse educator working in academia, can be very time consuming to provide meaningful feedback, tailored feedback, especially if a student spends hours writing a well-researched paper. I feel like, giving that to them, it can help expedite that. But again, as the educator, reviewing what the AI came up with and supplementing with the AI is helpful. Plagiarism detection, and I feel like that's been around for several years and is getting smarter, helping with grading essays, remote learning, and use of telehealth, and potentially helping to reduce educator workload. Plagiarism, an example would be like Turnitin, most trusted in academia for plagiarism. AI generated text like CopyLeaks, GPT-0, QText, Zero GPT, those things. All right, so I have this little video about our AI simulation in our orthopedic area of Sanford.
Surgeons in training at Sanford Health have another tool to sharpen their skills. In tonight's Eye on Kellyland, Kelly Volk shows you the technology and what it means for doctors and patients.
This may look like some sort of video game, but these headsets and hand controls are actually playing a role in medical training.
Looking at other people use it, I feel like it looks a little silly, but when you're actually using it yourself, it's not bad at all.
Dr. Michael LaRock is a third-year orthopedic surgery resident from the University of North Dakota. He can use the Precision OS virtual training platform to simulate working with a patient.
You kind of just disappear into the virtual reality. It's kind of strange. because then you take it off and it's kind of like, oh, whoa, I forgot I was actually wearing a headset there for a second.
Here, LaRock, another resident, and orthopedic surgeon, Dr. Nathan Skelly, are doing a demonstration for KELOLAND News. They're using the technology to put a virtual camera in a patient's shoulder.
This is going to give us the opportunity to kind of understand that makeup within the patient's shoulder, to know how we're going to go about fixing the problems that they have, whether it's a tear within the biceps tendon or a cartilage lesion within the arm bone.
Skelly is the Associate Program Director for the Sanford Health Orthopedic Surgery Residency Program.
We can perform collaborative procedures where the residents are able to work directly with me. They can work with each other as peers, or they can work one-on-one with the platform. We're able to go through surgical procedures. We're able to go through device exploration using different surgical tools.
The Precision OS technology can be used outside of the hospital, allowing residents to step into a virtual operating room from anywhere at any time.
So much of medicine, you have to be on site with patients in labs. This is kind of a nice thing that you can just have at home and use. You could bring it on a trip, you could bring it wherever, you're completely at your own convenience.
Another benefit of using virtual reality is it doesn't involve real patients.
There's a reset button. If a surgeon's learning a procedure and they're struggling, they can start the procedure over. They can do it 10 times, 20 times, 100 times, even 1,000 times if they had to. In the operating room, surgeons don't have that luxury. We get one chance to get it right for our patients.
You can do a lot of studying and reading and try to prepare using books and videos, but the ability to actually be in a virtual reality space and look at the tools and the instruments, look at the anatomy and the human body, and then being able to just start out by playing around with this stuff, go through the steps, get things wrong without it mattering at all, and just having some repetition before you're in the operating room, or even after you've been in the operating room to try and reinforce some things, it provides a lot of valuable opportunity.
Ultimately, that helps patients.
This is a very
All right, I think you get the gist of that. Let me go back to presenting. Oh. Oh, let me stop sharing for a second. Sorry. All right. And we're back. Just wanted to bring up some top AI peer-reviewed healthcare journals. The star there indicates that they're open access journals, but there's a lot more peer-reviewed education coming out and accessibility of information of what different healthcare things are doing and the impacts of AI in healthcare. AI in research, identifying potential trial participants. It can accelerate drug discovery by analyzing large data sets, identifying potential drug targets, and simulating clinical trials. AI in wellness prevention. I've used it myself. I taught a Pilates in the park for my little rural community, and I wanted it to be 45 minutes, full body. And I said, what exercises can I use? And it created an exercise plan for me. And I was like, yes, this would have taken me hours to figure this out. Or personalized diets, typing into AI and saying, give me some low calorie, high protein breakfast ideas that are grab and go recipes. Blah, 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 blah. And sometimes I'll use it like in my pantry. I say, okay, I have these 3 ingredients. What should I make for my family tonight? Here are some options. Da, 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 da. Gosh, this is nice. It can help track sleeping routines or give you cues for sleep hygiene. It can help with stress management, maybe AI health coaching, kind of like the twin health stuff I was talking about. You can use it for financial goals or budgeting, the AI assistance that we already talked about. Ethical considerations, and this is a huge part of it. Where is your data privacy and the cybersecurity of it? There's risk for nonsensical or inaccurate generated outputs. So again, that is the AI hallucinating. You have to think about the legal compliance part of it. In Europe, there's the GDPR international data. Maybe there's some data encryption, role-based access controls, de-identifying things, making things anonymous, informed consent, which I gave you an example of that, human rights, fairness, and transparency. And there is a lot of potential bias with data sets lacking diversity. For example, we might have more of a Native American population here in South Dakota than if you go to Hawaii, that might have Pacific Islander data, and that might not be similar apples to apples when you're comparing healthcare outcomes. Accessibility, voice recognition, type to speech. Just recently in our video visits, it came with closed caption. And with me talking to a lot more elderly folks, I was like, what a great option so that it's more accessible for diversity. Another diversity comment with the ambient listening device, there's a tool on there that I can change the pronouns or make gender neutral pronouns. There's also a tool to make it more formal or less formal. So I think that's fantastic. Yeah, we got to be careful. AI chatbots are not licensed clinicians. There might be some resistance to change, and there's always continuous learning. Change management. And there is some regulatory that's coming out. For example, Senator Mike Rounds in the United States, he's from South Dakota. He sits on the Senate committee for AI. There's different states that are changing different laws and the use of AI or how AI can represent itself or some of the privacy options. And so more transparency and where AI is being used and requiring a human to make a final decision making and show evidence of minimizing bias within the AI. You want to look at what is the clinical benefit versus what is the financial return on investment. Does it do what it says it does? In a lot of healthcare organizations, this might be a committee of people. It might be a clinician. It might be a financial person. It might be IT, all sitting together to see. There's a big workflow of what we do allow and how it touches patients and auditing the system. How is it performing? Is it doing like it's saying it's doing? Looking for the goals if the AI is meeting those goals and having goals set. Finding AI vendors that meet several services with one product rather than niche solutions one by one. Let's see here. Making sure healthcare is driving the tech and not tech driving healthcare. So it's trying to find a solution for a problem that doesn't exist. So making sure that it's meaning and AI governance within health system, collaborating with clinicians and the IT, the privacy, the compliance. All right. 5 minutes of questions. Reach out to me. I'd be happy to answer them.
Thank you. That was so informative and just quite wonderful. So I want to open up the floor right now to Q&A. You can use your chat feature. Alternatively, if you would like to raise your hand, we can unmute you as well if you'd prefer to field a live question. While we are waiting on that, let me do a brief plug to remind everyone that our next session is going to be held on June 11th, and that is AI and the Learning Alignment Problem with Dr. Michael Rowe, who is at the University of Lincoln in the UK. And then there are several others that will continue throughout the year. Any questions before we send you off on your evening or morning? Here's one. Are there any programs for contact tracing?
I am not aware of that in the infection prevention realm, but I didn't come across that specifically, but that would make sense for it to be used there.
And I will say what we can do too is poke around on our end. And if we find anything, we can circle back or drop it into the community too. We are doing an information shared in our last session. So if we find something, or maybe we can pass that off to Abby and have her look at it, because that's not till December as well. But if anyone here finds anything, please feel free to let us know, drop us an email, drop it in our community. I just want to say the presentation was fantastic. Critical access nurse here in rural Illinois. Our small hospitals can't afford Epic, so a lot of this AI information was new. Thank you. Excellent, Karen. That's exactly what we want to hear, and we hope that this is helpful for everyone. We are going to be archiving this on our GRNEN website, so if you want to like jump back in, check in some resources, share this with a colleague that wasn't able to make it today, or you think would be find this information useful, please feel free to do that. It should be up by Monday. So if there are any questions that come up after, obviously you can hit up Sandra. You can also hit us up at info@grnen.org, and we'll make sure to patch you through to her. But thank you so very much for joining us. Thank you, Sandra, for the presentation. We are so grateful that we were connected to you and able to put this together. I so appreciate your time today. Yeah, and everyone, have a great rest of your day. Take care.